Hello? Hello, 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 hello. Ayan. Okay, we have audience now. Hello, can you hear me now? Am I clear? Moira, am I clear? Or Yoni? Yoni. Yeah, palang PR. Sorry, sorry. I don't know what happened. It was gone. I hope you're understanding my English. You can understand my English. I'm not that good in English. I came from a bad high school life. Yes, thank you so much, Elizabeth Reol also. Okay, so where was I? Okay, the hardest subject. I don't think you heard it. The hardest subject in every school or a hardest subject, things that you do, is always depends on your talent and skills. Okay, some people are good in math but bad in science. Some people are bad in science. I bad in science but good in math. So, kala ko sign language. Ano yung Myra? Kala ko. Sorry, sorry, sorry. Okay. Okay, SO is for those poor, destitute, LMC, and the other that has no mental and dental care. What do you mean by destitute? I'm sorry, I don't understand the word destitute. Say it wasn't. Good morning, docs. Arkhe. Ilang years po magtatagal ng fixed bridge? So she is asking, how long is a fixed bridge last? Okay. So it depends, of course, on the material, on the strength of the tooth, and at the same time, what is left on the tooth. Okay. If your tooth was so badly broken before it was placed on a fixed bridge, it will lessen the longevity or it will lessen the lifespan of the fixed bridge. At the same time, if the material is different, okay, it will also lessen the longevity. If it's a zirconia, it will last longer. But sometimes the failure of fixed bridge is not actually on the fixed bridge itself. The failure of a fixed bridge usually lies on the tooth itself because the fixed bridge doesn't break. I rarely see it break. I rarely see it fracture. It usually is the tooth that breaks down. Sometimes the tooth fractures, that's why fixed bridge gets removed, or the tooth starts to move, that's why it gets extracted. So, fixed bridge lifespan always depends on the tooth, not on the fixed bridge. So depending on what's the situation of your tooth before you had your fixed bridge on, and that will dictate how long it will last. So as soon as possible, as early as possible, as strong your tooth is in, as long as your tooth is still strong, it will last long. So I always say this: the earlier, the better. Okay. Hi, Sad Rosikin. Hi. Diane Rose Abejo. Hello, Doc. What will happen if uh, yung buto ng ngipin is nasira? Okay? If the bone of the tooth is broken, more or less you have periodontitis. Okay? My baby is starting to wake up. You want to see my baby? Dito pa ito natin yung baby natin. Okay, this is my baby. Pakita natin sa live. Ta-da! It is crying! It is crying! Look at my baby. So beautiful. Okay, so her mother will fix her up. See? Yeah. So, yeah. Okay, let's go back. Sorry for the uh, brief interruption. Okay. Okay. What will happen if the bone is the one that is destroyed, not the tooth? Okay. Bone is one of the biggest factor of the longevity of a tooth. The tooth can be dead, but it will still be there and it will still work as your grinding material. Let's say this tooth is already dead, okay, but the bone is still good. You can still root canal treat this tooth, can have it root canal treated, and you can still use that tooth for a long time. Okay, you can still use that tooth for 12 years or 15 years. But the problem is if the bone is the problem. Okay, even if the tooth is alive, if the bone is the problem, you cannot use this function. You cannot use the tooth's function properly because more or less it will be moving. Okay, if it's moving, more or less it's not gonna crush your food properly. Okay, so sometimes the bone is more important than the life of the tooth. Okay, because you can always root canal and restore the tooth, but bone is very difficult to restore. That's why, in order to protect your bone, you always have to have your teeth cleaned by the dentist because the bacteria, the germs or bacteria that is around the tooth will be the one to destroy the bone. Okay? Victoria Cagaya. Doc, pagbunot ng ngipin, ilang araw pwede mangnigarilyo? Okay? When can I smoke after a tooth extraction? Okay? Never. Okay? Better never have smoke. never smoke again. Okay? So that's what we want. Okay? But of course, we have different source of happiness. Of course, we will not stop you from from smoking. But smoking, usually, the better is more than 4 days. Okay, the better is more than 4 days because as much as possible, we avoid negative pressure because uh, if you watch my video about extraction after extraction, you cannot have have negative pressure on the mouth at the same time you cannot have heat. Okay, you cannot have heat on your mouth, and smoking has negative pressure where you're sucking, you might suck the blood out. At the same time, it is hot, so it will cause the blood to be soft. Okay, but if you have your suture, okay, you had an extraction and you ask the dentist to have it sutured or closed using a suture material, you can smoke after 2 or 3 days. Okay, because it is closed. Okay, unlike an open wound, you have to stop smoking for 3 to 4 days. Okay. Victoria Hagaya, Doc, kapag bunot... Okay. Mirna Sisik, Doc, what if kung expired na nagamit anesthesia? What will happen if you've been used with a expired anesthetics? Okay. Usually nothing. Okay. Even the numbing is less effective. Okay. But it is not toxic. It is not poisonous. Kasi more or less, if there is toxic in there, as long as there are no bacteria inside the anesthetics, because it is sterile there's no bacteria inside. So there is no toxic inside. More or less, everything will be just less effective. It is expired. So do not worry. Nothing will happen. It will just be less effective. Okay. Not unless, usually, if it's very old, sometimes the cap is getting rusty, that will might affect your health. But if it's just 6 months or 1 year expired, nothing bad will happen. But don't worry, almost all dentists, if it's expired, we throw it out. Okay. Oliver Berto Panogaw, ask ko lang doc if pwedeng inguya i-toothbrush ang okay. How can I brush a temporary feeling, or can I chew food with a temporary feeling? Not on the first day. Okay, you do not grind food on a temporary feeling on its first day, meaning 24 hours. Okay, because it takes time before it gets hard. Okay, so sometimes you can see some material going out because it's still not yet that hard. So you wait for one whole day before you chew your food on that temporary feeling. Okay, you let it harden first. Okay, so toothbrush feeling, you just slightly, even though it's after a day already, you slight brush it. Okay, make sure you do not brush too hard. James Homosissima. Good morning, Doc. What will I do to reduce the cavity in my molar tooth? That is, if you've noticed my videos, I don't post any videos on how to heal your tooth at home. Okay, because you cannot heal your tooth at home. You can only prevent damage on your tooth, or you can stop pain on your tooth, but you cannot reduce the cavity on your tooth at home, because enamel is a very hard substance. It doesn't heal. Okay, so the only way you can repair an enamel or your tooth is you go to the dentist. Okay, there are no home remedies, there are no hacks on how to heal your tooth. Only the dentist can heal your tooth. Okay, unlike other problems, if it's on the lips, you can heal it. If it's on the gums, you can heal it. We can teach you how to heal it. But on the tooth itself, it cannot. Okay, it's the only part of the body that doesn't heal itself when broken down. Okay, unlike yeah, that's the only part of the body. Okay, Justin Canoy, Doc, what happens? Uh, Okay, what happens if my tooth has a cavity and the gums swell sometimes? Sometimes there's pus coming out, and sometimes there's gum boil. That's what you call gum boil. Okay, there's something swelling. Okay, more or less you have to have it root canal treated or have the tooth extracted. Okay, but I suggest you have it root canal treated. Okay, more or less the tooth is already dead and bacteria is forming inside the tooth. And as long as bacteria is inside there, your gums will get irritated and pus will be formed. And as long as it's the bacteria is there, it will come back and come back and come back until you remove the bacteria inside. And how can you remove the bacteria inside? You can have the tooth extracted or you can have your root canal treatment. Okay? Cane. Oh yeah. Oh yeah. Okay. Kent Diwata, Doc, after magpa-cleaning at pasta, ilang oras pwede na ulit kumain? Okay. After cleaning or tooth filling, how many hours before I can eat? Okay, if your cleaning was severe, okay, let's say your teeth is very very dirty before you had your cleaning, I suggest you eat after 2 to 3 hours. Okay, because after the cleaning your gums will be open. Okay, because usually, why is it open? No, it's actually not open. It's spreaded out by the bacteria inside before. So when you remove the bacteria, there will be a space inside your gums and your tooth because it's already clean. So you wait for 1.5 hours before the gum closes again before you eat your food. Okay, 2 to 3 hours is better. Okay, but after tooth filling, as long as it's not temporary filling, you can eat immediately. If it's a tooth filling only, you can eat immediately. Okay, unless it's a different material. If it's composite material, you can eat immediately. But if it's a temporary feeling, you have to wait for a day. Doc, pwede ba i-file yung chip tooth ko sa front? Okay, these are being, I saw this on TikTok where they use the file and they grind the tooth. Okay, we cannot stop you doing that, but I don't really suggest it because once you over trim, it's gonna be sensitive, and at the same time it might not be symmetrical to your face. Okay, that's why it's better if you ask the dentist, because the dentist can knows the anatomy of the tooth very as good as our back of our hand. We know the shape, we know the proper shape, we know the proper proportion of a tooth where we can make a beautiful smile. But if you're the one who's gonna do it, you might not do it good. You might make it more slanting or whatever. So I suggest you just ask your dentist to reduce it. It's not expensive, so just ask your dentist to fix that one. Okay. MCNP, I think it's better you have your consultation so we can answer those questions, because your questions are a little bit specific, too specific that you need a proper consultation already. Okay, MCMT. Okay, Jonah Carpio. Doc, may crack po kasi ang ngipin ko. Pwede mo veneer? Okay, Doc, I have a crack on my tooth. Okay, depending on the crack, how big the crack is. If the crack is very small, you can still have your veneers. But if the crack is already half of the tooth, you need your dental crown already. Okay. Penuela Alan, hello. Kumusta? I'm good. Medyo puyat, pero okay lang. Sophia Kayan, Doc, magpapabrace po ako. Kailan po maganda magpa-implant, before or after braces? Okay? Everything that is prosthetic, meaning a replacement of a tooth, is always best after braces. Okay, if you're gonna have a denture, fixed bridge, implant, whatever you're gonna place to your teeth, it is always best after braces. Why? You fix first your teeth, you compress the teeth, meaning the spaces, you remove the spaces, fix the teeth before you have your denture, implant, or fixed bridge, because it will result in a better prosthesis, or it will give you a better implant, a better denture, a better feeling, a better grinding power. So I suggest, if you want to have a very good smile, have your braces first before you have your permanent restorations. Okay, so that is the sequence of it. Have your teeth filled. I have cleaning, tooth filling, extract any unwanted tooth, have your braces, have your denture or your implant or your fixed bridge. That is the usual sequence. Okay. Okay, next. Hi, you and Ingraham. Cheque Crosby, I don't know Ingraham is. What is Ingraham? I'm sorry. Hi, Patricia Kamua. Wow, super pretty baby. Thank you so much. Yes. Sana nagmana kay mama, hindi sa akin. Elizabeth Reyoloso. Hello, Doc. Ano po kaya possible reason kung bakit po ako nagkaka-lockjaw? Twice na po ako Okay, TMJ. Doc, Elizabeth is asking, why do I have lockjaw? What is lockjaw? Lockjaw is when you open your mouth and you cannot close it anymore. Okay, it locked. Okay, that's why we call it lockjaw. There are so many reasons why you have your lockjaw. More or less, first is you have your bite. Your bite is not that good. Okay, sometimes if your bite is not good, let's say there's a tooth sticking out here, and when you bite, it causes imbalance here. Okay, every time you bite, your jaw goes like this. So what will happen? There will be tension on one tendon, and there will be relaxation on one area. Okay, there will be damage on your TMJ here. Okay, once the TMJ is damaged, okay, when you open, there is a cartilage here. Okay, cartilage. What do you mean by cartilage? The reason why you're able to move your elbow, there's a cartilage here. Yung lited. Okay, lited. Okay. So you have a cartilage here. If that cartilage is broken, okay, nothing will stop your jaw from being forwarded. Okay, so that will be forwarded. If once it's teared, okay, napunit yung muscles here, nothing will stop it from going forward and being stuck like there. Okay, because you already broke the tendon here. So you will have a lockjaw most of the time. Okay, usually once you had your lockjaw for the first time, it will be easier for you to have a lockjaw for the second, third, and fourth, and so on time. So you, as much as possible, avoid having lockjaw because it's gonna be easier for you to have a lockjaw after your first one. Okay, mas dadali na yung pagiging pagkaka-lockjaw. So, avoid it as much as possible. Avoid eating big food, biting way too big. Okay, do not avoid this. Avoid opening your mouth too much. Okay, do not service your boyfriend too much. I'm just joking. Just joking. Okay, so try to avoid opening your mouth too much. Okay. Yes, baby reveal. Thank you, MC. Okay, happy Father's Day. Cute ng baby. Thank you, say. Jonah Carpio, Doc, may crack po kasi ang ngipin ko. Pwede po ba i-veneer ang solusyon? Yes po, pwede po. Depende po sa laki ng crack. Jade Solo, thank you so much. Cute nga siya. Daniel Costa, BR. I don't know what BR means. Sorry. Fala Otot. Otot? Hi, Doc. Ask lang. Otot. Hello, Otot. Ask lang po, anong type yung napapasta sa molar ko a month ago? Hindi pa rin nag-blend sa color ng ngipin ko. Pangit po tingnan. What color yung pasta, sir? Kasi usually, some dentists doesn't prioritize aesthetics on the molar. They prioritize strength. Okay? Sometimes I use a different color of composite but it's stronger. Okay, it doesn't blend that much, but it's usually stronger. So you ask your dentist if she used a different kind of composite because usually stronger composite usually has a different color. Okay, so maybe your dentist used a stronger color, a stronger composite for your molar because it's not on the front, so it can be in a different color. Okay. Golfeo, hi John. Okay. No eulogio kapag sumakit ngipin to. Maraming dahilan ba't sumakit yung ngipin. So, I think you have to be more specific. Ishan, hi Doc. Hello. John Aaron, what causes teeth fluorosis? Sana matot. Tooth fluorosis is usually drinking too much fluoride during the young age. Okay. If you're drinking too much fluoride when you were young, around, I think it's around 3 to 10 years old, if you're drinking a lot and a lot of fluoride, that's too much that causes fluorosis. But do not worry. When you're using fluoride as a topical, the one you're using your toothpaste, at the same time, the one that this dentist is applying to your teeth, it will prevent fluorosis or it will heal the fluorosis. But when you're drinking water with a high amount of fluoride, usually this happens on Cavite. If you're on John Aaron, if you're from Cavite, usually the fluoride content of the water there is very, very high. Okay? So, that usually causes fluorosis. Okay? Princess Pontejos, hello Doc, bakit po nagkakaroon ng impactive wisdom tooth? Nagko-contribute po ba siya para magkaroon ng TMJ disorder? So, Princess Pontejos is asking, Doc, is impacted tooth affecting the TMJ disorder? Okay. So why does we have impacted tooth? We have a long story why we have an impacted tooth because uh, before, during the time where there are no fire, wala pang apoy, when we're still looking like monkeys, okay, we used to have a fourth molar. Okay, wisdom tooth is third molar. Okay, we used to have fourth molar. Fourth molar is used for grinding raw foods. Okay, raw food. Sometimes raw plant. We're eating raw plant when we're millions of years ago. We're eating that. But when they discovered fire, food starts to get softer. Okay, and when it became softer, we no longer needed fourth molar. That's why eventually evolution, the fourth molar was gone. Okay, and nowadays, because the food is very soft, we have our pressure cooker, we have our oven, we have our different styles of or techniques on how the food will be softer. We are starting to lose function for our third molar. Okay, and because the third molar is no longer needed, sometimes it doesn't know where to go. Okay, because the tooth will erupt on where the function is. If you're always chewing food, the tooth will know, I'm needed there, that's where I grow. But the third molar is starting not to be really useful because you're just chewing your food on the front part because it's already uh andito pa lang siya sa harapan, durog na siya. You are starting not to use your third molar anymore. That's why it loses function. That's why it grows on a different position. That's why it becomes impacted because it loses its function. Okay? So at the same time, genetics can also cause impacted. Of course, it can also contribute on TMJ problem. The one I told you, when your third molar is pushing your teeth, that other teeth will cause different position, and it can cause malocclusion. If you have different bite, you'll have a different TMJ. So you can have problem. Okay. Abay Sarep, hello. Hyper, hello. Okay. Laika, hi doc, normal lang po ba ma-feel na slight discomfort dun sa tooth months after root canal treatment? Okay, you asked your dentist, go to back to your dentist, have um show ask her to show your x-ray, check if it's well filled. Okay, if it's not yet well filled, you ask the dentist, can she do it proper, she can redo it. Okay, because if the root canal filling does not reach the end of the tooth, it will still hurt. Okay, so you can ask your dentist for the x-ray if you want to see what uh what is the situation of the root canal treatment. Okay. Ana Luna Navales. Hello po, Doc. Galing galing ko dentist dito sa Malaysia kahapon. One missing tooth lang sabi. Di daw pwede flexible sa fixed bridge daw. Sobrang mahal. 3,000 ringgit per sa Pinas, more than 30K. Okay, Analu Navales, more or less it is because maybe they're using zirconia nowadays in Malaysia. That's why it's expensive. In the Philippines, it's around 20 to 25,000. So the price is not that different. But actually, you can actually use flexible denture on your missing teeth. Uh, Actually, you can have your second opinion. You can always have your second opinion. If it can be used with fixed bridge, it can be used with denture. Okay. If it is sometimes if you can do a fixed bridge on a patient, you can always do denture. Okay, pwede laging postizo. But not all but not it's not vice versa, okay? So you can have your second opinion if it's too expensive for you. There is always a cheaper option. Marian Magnipes, pwede po ba magpa-brace agad after ng pasta? Yes po, pwede po magpa-braces after magpa-pasta. PJ Restor, shout out. Thank you. Thank you for the shout out. Charlotte Grace Peroy, Doc, does your clinic offer X-ray? If yes, how much? Yes, we have X-ray. It's around 950 pesos for our patient with the printout 50 pesos. Okay, it's around 1,000 pesos, but you can take an X-ray of the whole teeth already. Okay, that price I can announce because it's a fixed price. Okay, it doesn't depend on the patient. It's a fixed price. Okay, panoramic X-ray is around 1,000 pesos, but it's for the all the teeth. I'm telling you, as much as possible, have your panoramic X-ray at least once a year. Okay, in panoramic X-ray, you will see the growth of the bacteria, the growth of the cavity, the health of your bone. So if you want a prevention, better than cure, you have you have to have your X-rays at least once a year. Okay, once every 2 years is okay, but it's better once a year. Okay. Actually, in the United States, they every 6 months in the US. But in the Philippines, once a year is okay. Better if it's every 3 months. Okay. Dok, sa area namin, wala kasing root canal na available. Island kami. Front teeth na nagnanana siya sa gums sa taas. Sila nang second choice, sabi ng dentist amin. Armand Sapatan is asking, there are no there are no dentists that knows how to do root canal treatment on his island. Okay, but veneer is different with root canal treatment. Veneer is restoring the appearance of the tooth, but root canal treatment is treating the vitality of the tooth, the nerves of the tooth. So it's a different treatment. Okay, it's not the same treatment for the nana, for the pus. Okay, so if it's nagnanana, even if you place veneer, it will still have nana. Okay, veneer will not treat the nana. Okay, root canal treatment will be the one to treat the nana. So veneer is not an option if you don't will not do root canal treatment. So maybe you can transfer on a different island where the root canal treatment is have it root canal before you have it veneered. Okay. Shema, happy Father's Day to your father also. Abay Sarep, good morning Doc. Ask ko lang po kung ano nangyari sa kapatid ko. Nawala po kasi yung boses niya. Napaos na lang po siya tas di na bumalik. Ilang buwan na pong ganun. Ano po kayang pwedeng gawin? Salamat, Doc. I'm sorry, I think that is for the ENT already. That's for the throat already. I don't know what to do about it anymore. But I hope he gets well soon. Okay. But I'm not an expert when it comes to voice and throat. Okay. I'm sorry, I cannot help. Victoria Kagaya, Doc, 3 days na nagpabunot ako, naligo ako ng mainit at nag-blower ng hair hot dito. Ako sa Japan, malamig kasi. Okay, Victoria Kagaya is asking, after extraction, she had a hot shower and hot blower because in Japan, it's very cold and sumakit yung ano niya. So, what do you say? Okay, as much as possible, if you have infection and sumakit yung ulo mo, more or less, avoid hot pressure at hot shower, not that hot, because of course if you have infection it will worsen your situation. Okay, if you don't know if you have infection or not, wait until 4 days before you have your hot shower. 3 days. Okay, I'm not sure if it's because of it can be a different cause, but not the extraction, because after 3 days, I think it's already good to have a hot shower. Maybe it's a different cause, not the extraction. Not unless you have an infection. Okay. Ben Lord Bartolo, Doc, what should I do when my tooth starts to ache? Go to the dentist. That's the best thing you can do. Arnie Delova, hi Doc, ask ko lang kung saan clinic mo, mahal ba, and ano. I will post my clinic, just wait for no. Okay, next, saan po kayo located? Nagka-cashless payment po ba kayo? Yes po, we do GCash and bank transfer. Do be here, Doc, meron ako postizo na porcelain. Pwede po ba kumain yun kagamit kung magpagawa ulit ako bagong postizo? Pwede pa, but it will be more difficult. Okay, but because porcelain is very difficult to bite, to fix the bite. Actually, your lab can do it. You can always request your dentist. But if it's plastic, you cannot reuse it anymore. But if it's porcelain, I think you can still reuse it. Okay, Arvin Lawrence, just give it to your dentist. Okay. Arvin Lawrence, hello po doc, pwede po ba yung partial brace lang, yung as in two front teeth lang, alisin lang yung space in between? Okay, Arvin Lawrence is asking if he can have a braces for only two teeth dito lang on the front. Because there is space, he wants to close it. But just remember, Arvin, if you close these two, what will happen to the space in between here? You will have another space here. Okay, so it's usually everything should be closed. So it's better to have a full out braces. Okay. Sometimes you can use retainer to close it out if your teeth is a little bit too forward. Okay, last 10 questions. I'm starting to lose my voice. I'm sorry. Okay, I will just write my dental clinic again. You can you can chat this on Facebook page. We have a Facebook page. My mother and my wife is answering the queries there, and you can have your schedule there. Okay, choice market. Uh, that is my ano. Okay, how do you okay. Doc, okay lang po ba? Is it okay to use Sensodyne for sensitive teeth or may specific na Sensodyne need na gamitin? Okay, actually, all Sensodyne is for sensitive teeth. So, no matter what Sensodyne is there. But it's better to use the repair one, the brand new one, Sensodyne Repair, because the protection for sensitivity is longer. Okay, Daji, how often do you recommend brushing teeth? Twice a day. Okay, twice a day is okay. Three times a day is a little too much. Twice a day is okay. Okay, it depends on how how sweet your food is. Okay, if you're eating too much sweet foods, more brushing is better. But if you don't eat too much sweet foods, twice a day is okay. 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 Victoria Kagaya, is it okay to use a mouthwash after extraction? Yes, it's okay, but do not use force. Okay, do not do this. Okay, if you're gonna use a mouthwash after an extraction, 5 hours after extraction, you just place it there for 30 seconds, then spit out. Okay, do not place motion, do not place pressure. Just put it into your mouth. Wait for 30 seconds, spit, then do not touch it for 30 minutes. Okay. Okay, Berindes James. Okay. I had my tooth extraction on June 18, and now I can see swelling and sometimes there's whitish substance. Okay. Sometimes that whitish substance is what you call the granulation tissue, meaning it starts to heal already. Do not remove that white substance because it is a type of healing. Sometimes the blood will turn into white, then it will to turn into red again, then it will turn into a gum tissue. Okay, magiging gilagid din siya eventually. Do not remove the white stuff. It's normal. Okay, the swelling is usually up to 2 to 3 days, and after that, it's gonna stop swelling already. So don't panic yet. If it's painful after 3 days, that's the time you panic. I no no. That's the time you ask your dentist if there's something wrong. Okay? Jezreel, Brigham, Sagwitin. Hello po, Doc. May sungki po ako sa likod ng upper teeth. Okay, as long as it's crowding or sungki, pwede braces. Okay? Braces can be used. Okay, Ben Lord Bartolo, prevention is the better way to avoid painful teeth, and usually can use paracetamol, mefenamic acid to avoid pain on your teeth. Okay? We have a video that Ben Lord Bartolo. We have a video for that. You can watch that. Medyo mahaba eh. Kay Rabel Katu, hello po. Yan. Ralph Libiran. Saan school kay graduate? I graduate in Our Lady of Fatima University. I teach dentistry in Our Lady of Fatima University. Genocide Madara, I love watching your videos. Thank you so much for watching. Okay, actually, we are 234,000 subscribers. Thank you again. Thank you so much. I will try my best to improve my videos. Actually, as you can see, because of your support, I was able to buy this camera. That's why you're seeing me in a much clearer live stream, unlike before. And you're gonna see a 4K video soon of tooth restoration and tooth cleaning. Okay, I actually shot a tooth cleaning with 4K, so you will have a clearer visuals. Okay, it's a lot difficult. I had to study. I have to research on how to take a good video because not much dentists are sharing on how to do it. So I have to study it on my own. Okay, so expect a good quality video soon because that is thank you to your support. Thank you so much. Thank you so much. I really, really appreciate all your comments, your likes. I'm just sorry I cannot reply to them all because it's thousands of comments. It's overwhelming and I have other duties. That's why I cannot reply to it. But sometimes I read it and I really appreciate it. Thank you all for liking and commenting. Okay. Kay Diane Rose Abejo, ano pong dahilan ng pagtunog ng nguya pag nguya? Okay? Whenever I'm chewing food, there's sounds on the jaw. More or less, it's because of your cartilage being damaged. Okay? If you have cartilage damage here, that's why there's a different motion. So, we can fix that. Sometimes it is painful, sometimes it is not. But if it's not painful, usually we kind of ignore it, but it's better to fix it, but sometimes it's a little bit expensive to fix it. So it depends. But if it's painful, you go to the dentist as soon as possible. Okay. Sawadi cup. I'm sorry, I do not understand Sawadi cup. Holic. Okay, how can I go to your clinic from MRT Shaw Boulevard? Okay, you can just ride a jeepney for Antipolo. Okay, and it will pass through our mall choice market. Okay, Life Home, something like that. So if you go down from MRT Shaw, you just ride a jeep that's going to Tanay or Antipolo, and it will pass by our clinic. Okay? Ralph Libiran, paano malalaman na tao madalas sa oral sex? Okay? Ralph Libiran is asking, how would you know if the person is having oral sex that much? Okay? We sometimes check the palate because sometimes the palate will have what do you call this? Bruising on the palate. Okay? Meaning it's being poked a lot of time. But before it has manifestation on the palate, it has to be so many times before you can see a manifestation on the palate. There will be a slight swelling or slight inflammation on the palate because of the oral sex, and that's when we know that it's too much. Okay, it's too much. Okay. Next. Okay, Arnan is telling me that, Doc, is it okay to just have a veneer that is 2 and not 4, because his dentist is telling her to have telling him to have 4 veneers, okay? As long as it is even number, it is okay. What do you mean by even number? 2, 4, 6, 8. Okay, it's okay, but as long as the laboratory is good. But 2 centrals is good actually. As long as this 2 is veneered, that is okay. Okay, but it's the best is 8. That's the best number. 8. 10 actually is better, but 8 is okay as veneer. Okay. As long as it's not 3, it's not 5, it's even numbers. If you have gonna have veneer, have even numbers. 2, 4, 6, 8, 10. Doc, can I have a braces even with you can always have braces even if you have missing teeth. Okay. Any missing teeth you can have. As long as you have teeth, you can have braces. Okay, so I think we have to wrap this up. Transtech, happy Father's Day. Doc, did you graduate in US? Just wondering. No, I'm sorry, I did not graduate in US. But I trained on different countries in Taiwan, in Germany, and what else? Something like that. Okay, Arvin Lawrence, another question po. Pwede ba mag-match na empty? Yes, you can always, no, it's not dumb question, RV, it's okay. You can always place another tooth on a space. Okay? You can always move that. As long there is anchorage. Okay? Then there are situations where we cannot do it anymore, but usually we can do it. Okay? So just ask your dentist if the dentist can do what you request for. Anamika, happy Father's Day. Okay, BTS, I posted my address. Okay. So, ang daming question. No sa English. Okay. In my clinic, I think it's better to have an appointment first before you go there. Okay? Because syempre, it's pandemic. There's so many patients. Happy Father's Day, Mayan Cruz. John Sneaks, thank you for great content, Doc. It's really interesting and fun to watch. Very informative. Thank you so much, John Sneaks. I will try my best to post more. Miss Riani, ilang docs dapat ma-maintain ang ngipin ng bata? Mag 7 years old na lang. Hindi pa po napapalitan ang ngipin niya kahit isa. Okay, Miss Rain, you can have your panoramic x-ray on your child so you can check if you're still waiting for a tooth. Some patients, some people doesn't have replacement. Okay, so have an x-ray so you can check if you're waiting for something. Don't panic on the panic on 8 years old. Okay, if it's still not there, more or less there's a big problem. But 7 years old, it's still on the end point of the normal eruption because this teeth will erupt at 6 to 7 years old. So it is still within the age. But if it's 8 years old, that's too late already. Okay. Dina X-ray. Okay. Leah Pascual. Actually, X-rays is needed during root canal treatment. Okay. If you want a successful root canal treatment, X-ray is really important. Okay, good day sir. Saan po ang clinic niyo po? Okay, I posted my clinic. I will post it again later. Okay, good morning doc. Usually magkano po ang tooth implant? Usually tooth implant is usually 60 to 120,000 per implant. I have a question. Can mouth cause headaches? Of course, it can cause headaches because sometimes if you have malocclusion, your TMJ will be bent like this. And if it bends like this, sometimes there's too much pressure on this side. And the pressure will cause the nerves on the TMJ to cause a radiating pain over your head. So TMJ, the mouth can cause TMJ and the TMJ can cause headache. Okay. Shout out Gian Rose Basisi. Thank you very Elizabeth. Thank you very much, Doc. Ano po magandang gawin aside from avoiding those things na sinabi nyo a while ago? Kailangan po ba ng operation to repair broken tendon? Meron po ba nun? Yes po. We have TMJ specialists who specialize on TMJ. Medyo expensive, but it is worth it. They can remove the pain. Okay? Sometimes it's not surgery. Sometimes you just fix the teeth and it will fix the TMJ. Sometimes braces can be used to fix your teeth. Okay? Brenda Besing. Good afternoon, Doc. Ask ko lang if ano po yung irreversible pulpitis. So you have your RCT, 3 to 4 days, walang pain. Then nauwi sa bunot. Ba't nauwi sa bunot? Irreversible pulpitis is like the tooth is already dying. Okay? Sorry, I don't understand your question. Not that much. Kenneth Sombilan, totoo ba na nakakaitim ang root canal treatment? Is it true that root canal treatment can cause blackening of the teeth? Not really the root canal treatment, but the death of the tooth. As long as your tooth is dead, it will darken. Okay? And it is after root canal, more or less, your tooth is already dead. So, it's not because of the root canal treatment. It is because your tooth is already dead. Okay, that's why it gets darker. All teeth that is dead gets darker. Okay, Peter Reed, Doc, delikado po ba ang root resorption ng ngipin sa brace? Magiging dahilan po doon pagkatanggal ng ngipin. Yes, Peter Reed, that is the bad effect of excessive force during braces. Pag masyadong malakas yung force, it can cause root resorption. That's why if it's too much force, you tell the dentist, Doc, it is too much. It is too painful. It will cause root resorption. And root resorption can also be caused by long-term braces. If you have 5 years na naka-braces, it can cause root resorption. I will show you one time my patient's x-ray. Wala na siyang roots. Once you remove the braces, you will be removing the tooth already. Okay, so I saw one case like that. It's not my patient, but I saw an x-ray. Okay, Victoria Cagaya, thank you so much also for support. Marivic Pacheco, meron po bang tanong, bakit po lumain? Lumain ang ako, hinihingal po ako, meron po. Ay, sorry, medyo ENT na po yan, physician na po yan, non-dental na po, so I cannot answer it. Okay, masama kung sagutin ko siya. Elizabeth, anyway, Doc, thank you very much. Galing-galing mag-explain. Very clear. By the way. Happy Father's Day to you also, Elizabeth. Thank you so much. KOF Gaming, Doc, paano malaman kung kailangan i-redo ang RCT? Have an X-ray. X-ray mo siya if there is still swelling on below, on the apex, pag may nana pa rin, pag hindi filled ng maayos yung root canal, more or less kailangan i-redo ang RCT. You can see my video about root canal. Okay. Yung procedural, makikita mo may x-ray yun after. Dapat ganun yung itsura ng root canal treated tooth. Okay. Okay, I'm from Caribbean and one day I'll come visit you. Wow, thank you. Akil Bowen, thank you so much. Okay. FADMO, when do we use FPD or RPD? Okay, we can always use, for a case of FPD, you can always use RPD. But not all cases for RPD, you can use FPD. Okay? What do you mean by that? If FPD is an option for the patient, fixed partial denture is an option to the patient, you can always use RPD or removable partial denture. But on the cases there where removable partial denture is an option, it is not always applicable for fixed partial denture. Okay? So removable partial denture has more options, has more capabilities than the fixed partial denture. Okay, Fadmo, I hope I answered your question. Jade Solo, always watching Doc your videos, very informative and helpful. God bless. Thank you so much, Jade. Thank you so much. Expat, living in ME Dimples. Doc needs ba appointment or pwede walk-in? Better appointment because I'm not always on the clinic. Baka pagpunta mo, wala ako doon. EJ, Doc, matagal na past ako, more than 10 years ata. Natakot ako, okay pa check. Yes, you can always have your x-ray to check if your restorations are still good. Okay, because we can see any leakage of your restoration or your pasta through the x-ray. So if you're not scared, if you're scared, just have an x-ray. Panoramic x-ray will tell you everything you need to know. Okay, zirconia. Yes, Kent, Joshua. Of course, zirconia is better because it's the modern technology. But the problem is it is more expensive. Okay, Ruben Chuken, Los Ingles. Reynaldine Suarez, good morning. Miss Rain, thank you so much again, Miss Rain. Near Fatima. Before, nag-clinic ako dyan, pero we have trusted dentist naman there. Okay, happy Father's Day, expat. Thank you so much. Thank you. Okay, I will no longer answer question. I will just do shout outs. Doc, Von Ryan Teodoro, thank you so much. Jocelyn, thank you so much again for subscribing. Stuka Elite, yes, wisdom tooth can cause sinus pressure and headaches. Kenneth, thank you so much again. Happy Father's Day to your father and to you also. From Hong Kong, Rhea, thank you so much for watching. Okay, yes, pwede po mapastaan ang itim sa ngipin. James Harvey, hi Doc. Brenda, Doc, ano po ang accessory? May root canal, ginagawa doon. Yung accessory canal, it requires more skill. You just have to have the modern technology for it to be filled. Okay, Dela. Happy Father's Day, Marian Hernandez. James, may age limit po ba ang braces? No, walang age limit. I have a patient na 63 years old na. Okay. How to read OPG? I'm sorry, what is OPG? Can you ano? Okay, Delan Estilio. Ano po mas okay, veneer or crown after ng root canal? Veneer is okay. Pero root canal, crown will last longer. Number 2 question, need po ba talaga ng 2 teeth pang i-veneer or crown kung isa lang naman ang root canal? Yes, pag etong ni root canal sa'yo, dapat dalawa silang ipa-veneer mo or ipa-crown kasi hindi magbabagay yung color niya. So, lagi, if you touch this one, you have to touch this one also. Pero kung K9 naman, hindi mo na kailangan gawin yung kabila. Etong dalawang gitna lang ang kailangan. Happy Father's Day! K of Gaming, what is OPG? Okay. It's Tsunomi. Okay, oral sorry. Okay. I will post about panoramic x-ray soon. Will brushing your teeth not necessarily whiten your teeth? Yes, it's not necessary, but it will remove the stain. Okay? Because, of course, if you don't brush your teeth, the yellowish bacteria will cause your teeth to be more yellow. But if you brush your teeth, it will prevent it from being stained and it will remove your stain. So, of course, toothbrushing will affect the color of your teeth, but it doesn't whiten your teeth. It will just protect it from being discolored. Okay. For the 33 people who are still here, thank you so much for staying. Thank you so much. 34 people that is here, thank you so much for being here. I'm sorry I can only do this for 2 hours. I'm losing my voice. And I will try to do this every week if time permits, if my schedule permits. Because I'm a teacher at the university. I edit my videos. I am the current president of Alpha Phi Omega Dental Association of the Philippines. And I have a two clinics. I have clinic that is very busy, and I'm a father at the same time. So it's a little bit busy nowadays, but I will try my best to post as much as possible as once a week and to do a live video once a week. Okay, so the 39 people who is here, thank you so much for watching. I will see you soon. I will try my best to see you on Sunday or soon. So, thank you. Thank you so much. So, nagulo na yung buhok ko. God bless you all. And always remember that source of happiness is to smile and to eat. So, always take care of your teeth. I'm Dr. Arkhe De Leon, the dental architect. And thank you all so much. Goodbye. Thank you, Spartan from Algeria. Thank you.